Hi, thank you so much. We are definitely glad to be here. I'm going to go ahead and share my screen, and I promise not to do a very long presentation because as it was noted, some of you have seen this before, and I want to get into some good discussion since we have John here with us today. But just some background about the work that we do. I work for Wilkes Recovery Revolution. We're an accredited recovery community organization in Wilkes County, North Carolina. This means that we provide free non-clinical services and community advocacy, community building activities. This started in 2016 with the transitional housing program and has grown to house 8 unique programs. I coordinate the workforce development and educational attainment goals for our population, which includes this workforce, the Recovery Friendly Workplace Initiative. You can see here, we had Tyson on our radar initially. They're one of our early adopters, and we approached them. I just read through the email that I sent to connect a little bit further in this work. And we approached them because they were raising the rate of pay before others, in the state were. They have a free healthcare center, the Bright Blue Healthcare Center, on site for all of their employees and their families. They've increased benefits. They are really working to partner with the community to improve the conditions of their work family. So we approached 5 early adopters and launched our initiative. But this is building upon work that has been done for a very long time. Recovery Friendly Workplace specifically started as an initiative of Governor Sununu, the governor of New Hampshire, in 2018. They have a state-run initiative. It's administered in partnership with the state of New Hampshire, as well as Granite United Way, which is a chapter of their local United Way. I say this because I don't think anybody on this map here of engaged workplace initiatives would be where they are today without this launching. Similarly, this program wouldn't be where it was without the work of industrial hygienists, unionists, researchers, workplace wellness and safety advocates. So the kind of demystifying element of getting engaged with this work is understanding that a lot of the work has been done for us, right? We're collaborating and compiling information to partner with employers. Our number one goal for entering workplaces and partnering with employers is to combat the stigma about recovery, mental health struggles. So that way we can engage every person in the workplace with getting access to treatment, with talking about their experiences and engaging with the workplace culture so that a culture of wellness and recovery can control the environment rather than a culture of substance use and isolation. A little bit about Wilkes Recovery Revolution quickly. Again, we do have these 8 unique programs. I think it's important to note that before any of this work that I manage took place, there was a lot of boots on the ground community advocacy work that happened even before I was employed with Wilkes Recovery Revolution. Our executive director, Devin Lyle, has her own recovery journey. She's a person in long-term recovery and had to leave Wilkes County to receive services and care, leave her family, leave her children, her job, and go to Asheville. And so when she came back to Wilkes County, she said, that's enough. We need to have services here in Wilkes County. And since then to today has developed this robust recovery ecosystem with the support of others in our community and outside of our community to meet the need of individuals who are struggling. So it's really important to note that a lot of that work happened before we launched our initiative. In launching the initiative, we formed an advisory committee. This was before John came on as the chaplain in the HR department at Tyson, but Tyson was well represented on that steering committee. So we had employers, we had people who use substances, we had peer support specialists, a variety of stakeholders to discuss what the needs are for workforce development, economic development, health and safety in the workplace and in our community. And we developed, a kind of protocol for engaging with the initiative, a toolkit to provide resources, training, information, and actual handouts and posters to blow up and to give out to employees. And then we established some early adopters. So we considered our capacity to serve the employees. And John will correct me if I'm wrong, but I believe Tyson employs almost 3,000 people in Wilkes County with a population of 68,000. That's a giant portion of the people that we work with. So using them as an early adopter and partnering with them to continue the work that they were championing, we knew that we needed to take things bit by bit. That isn't quite how it went, even though it was our intentions. We started to get a lot of interest. We started to get a lot of requests for assistance outside of Wilkes County. And we started, because of that, Recovery Friendly NC. So here's a small sampling of the workplaces we've designated in Wilkes County, but we are so proud to announce that our statewide initiative, again, considering capacity and growing as we can, has designated Novant Health as our first statewide early adopter. Again, excellent champions of what's going well. I want to focus on, we have been affiliated with the Total Worker Health Program with the National Institute of Occupational Safety and Health. This means that we have researchers, we have resources, published articles, training materials about safety and health in the workplace at our fingertips. We also have access to a regional research center in Chapel Hill, so that when we compile some of these questions that our advisory committee is working through identifying, we can get some assistance right away at making sure that those questions are answered and that they're answered in a way that is effective and accessible for employers in North Carolina. We want to kind of bridge that gap between implementation in a community and establishing evidence-based practices. So I won't go too much into, I'll flip through these slides. I will make them available to you all, but I want to get some good questions for John here and talk about Tyson's engagement specifically. But this is our outreach presentation and some of the work we do in our orientation about stigma, how it can be overlooked when it's self-stigma, when it's a person walking into a workplace not wanting to share, not wanting to open up about their needs because of fear of punitive action, fear of not getting that raise, not getting that promotion. And so when we don't address the potential for self-stigma or the community stigma within the workplace, then we start to see policies develop that are stigmatizing and that are not supporting wellness. So we do make a big focus on stigma and addressing stigma as a form of primary prevention. We talk through the National Safety Council's data about people in recovery and the qualities that they can have. For some of us who do direct recovery support provision, these figures can be a little stigmatizing to read, right? Not everybody in recovery misses less work. Not everyone in recovery is healthier or better connected to a community, but those are the generalized qualities that we push in recovery service provision. Connect with your community, get to a healthcare provider that can meet your need, a behavioral health specialist that can meet your need, engage with your peer support specialist. And so the data shows that these conditions lead to a savings for the bottom line of an employer. So that's, I mean, it's a wonderful thing for employers to consider. The newest statistic that the National Safety Council put out that I think is really valuable, and I'll share the link in the chat in just a second, is that for every $1 that an employer invests in the mental well-being of their employees, there's a $4 return on investment. If we're looking at what's good for business, we know that that comes from an increase in productivity because our mental health needs are met. It could be that the person doesn't need to moonlight or have a second job anymore because their financial needs are met. And this can be from paying a living wage, paying above a living wage, or through providing unique and customizable accommodations to the unique needs of your employees. For instance, we hear a lot of employers giving vouchers for childcare, but there are no childcare centers available to take their children. So that compensation doesn't actually improve the financial wellness of the family of that employee. So that's just one example of why we kind of need to look at these accommodations in a very specific and person-centered light. We ask our employers to do a very simple process of engagement. I think John and I did an orientation training that lasted far beyond what we had planned on because the conversation just was organic and the questions and and considerations that we went through really made a difference in how we went forward together. So typically it's about a 90-minute orientation. We get you the boilerplate templated language for our letter of intent and a declaration to staff. That is the biggest piece of this engagement process for us, is that in implementation, we have a declaration to employees first off that says we are not perfect, but we are working to become recovery friendly because we have a dedication to you, to your health and wellness, and to the workplace culture. But the most important thing that this declaration to employees does is it establishes a direct line of communication. Who do you go forward to in the workplace? And this person is typically the person that's done that in orientation training or a recovery coach training, or has engaged with us in another way that gives them a little bit more of a competency of a trauma-informed approach to taking on these requests for support. And so for Tyson, that's John, and I'm going to stop sharing my screen here. I really love what Tyson did with their declaration to staff. They sent John over to our center here with a big teleprompter and camera, and we recorded my spiel about what recovery looks like, what Wilkes Recovery Revolution is doing in the community, what services are available to employees and family and friends. And there is an onboarding process at Tyson that takes a week. There's a week of orientation, and they've included that video in that orientation process so that, again, in this idea of primary prevention, so primary prevention of safety hazards, you review protocol and what you can and cannot do on the work floor or in the factory setting. And you also get information about health, wellness, and recovery. So I think that's absolutely wonderful. I'm going to turn it over to John to give a quick introduction of himself, and then I'd love to have some robust discussion and questions.
Sure. Thank you so much for having me. Just a great pleasure to be able to host this information that we came across through some innovative partners. And so we're thankful to be here. I've been working with Tyson for the last 2.5 years as a chaplain. It's a unique space. We've had chaplains in our workplace for at least the last 22 years. And really what that does is kind of an intersection between the social determinants as well as facing those spiritual elements in the workplace. And so we're trying to create a whole ecosystem, as has been stated, that is more palatable for what you're going to spend most of your time with at work, to have that kind of touch point to create an ease of function so that you don't have to go too far. And so I call myself a bridge to be able to access all of the great resource partners, especially as has been stated today is on this call.
And you touched on a really excellent point. I want to stop and share just a little bit more about the framework that we use when we're working with employer partners. We use only evidence-based information. So that means that we are still giving out information about those non-evidence-based, perhaps it's a meeting group or whatever that may be, because we find that it's successful in our community. But in terms of what we directly provide, it's all evidence-based. And so for health and wellness discussions, we use SAMHSA's 8 dimensions of wellness. And spirituality is one of those dimensions of wellness. It is as equally valuable to wellness per the Substance Abuse and Mental Health Services Administration of the US DHHS. It is as valuable to wellness as physical wellness or social wellness. And so when we're talking about engaging that in the workplace, it becomes really funny in today's world. And I think it's important to note that spirituality and religiosity and religion are 2 separate things. And so when we do trainings with employers, and John was a part of our pilot training, the Recovery Friendly Workplace training, we talk about what is spirituality in the workplace and how can we encourage that and engage people with that side of their wellness. One of the things that was brought up was community service. In-depth conversations with a small group of people, of peers. And I think having somebody focused on that area of wellness that is kind of the gateway between all of those other areas of wellness, as John mentioned, the social determinants that aren't always considered when we're looking at benefit plans or what we offer towards wellness in the workplace. Those conversations are really valuable in allowing employers to self-guide the way that they're going to engage those dimensions of wellness with their employees.
Yeah, and as you just stated as well, I mean, the workforce is totally changing over. We're in between generational shifts here. And so, what is important or was important to the generation before is not necessarily even noted or on the scale of importance right now for the team members who come into Tyson. I mean, you're talking about, 18 plus years old, and in that gap, they're not really interested in benefits because they're not sensed their mortality as of yet. And so with that being said, it's kind of being unique for me to come alongside them to help them to see that there are options, what it's going to look like in the future, what it can look like, what an accident looks like as far as the things we can account for in our health and environment and emotional stability. There's so many things that come along with that. And so being able to have, Wilkes Recovery as a partner has been a great bridge to also be able to direct them, as you said, being self-directed. Sometimes I think we just press the button and think, if we put up a few things that people will automatically engage that. It's not the case, is what we found. They don't sense the importance of it, as I said before. And so being able to have a partner that really, as I call them, if I can, the apple of recovery, if you will, to kind of, push them in that direction as an option to say, hey, here's something that you can utilize or not, but they're there. And to have that kind of come alongside that they do so well is quite effective for us.
I'd love to take some questions here. I think John and I could talk for hours. Tyson has an Upward Academy where they're offering GED classes and free tuition to their employees. There's so many things that Tyson is doing well, but I really want to hear your questions so that we can give you some more specific answers. Okay, so I see, John, what were the pitfalls of implementing the program? What have been the specific benefits to Tyson since enacting workplace-friendly programs? If you can speak to that a little bit.
Yeah. So as far as the pitfalls, I guess because of the landscape of, over 3,000 team members, the communication has been kind of rolling out slowly. That was one of the kind of pitfalls that we ran into of trying to, how can we host this information? How can we put it in front of them? Yeah, sure. New team members are coming in and they're getting to see this video. We implemented it through a social network that we have that's inward, that is a Beekeeper. And so most of our team members have to download the app, and that's how we communicate with them for other things, and being able to host that regularly, as well as our Facebook is quite engaged as far as when we first launched it. And so that's been a space, but major pitfall was just really the communication, and that also not just to the team members themselves, but also to the staff, supervisors, and being able to say, when someone's going through a challenge, you refer them to me. And so being able to give them logistical references on how this is supposed to roll out, as is before we already had a pathway. If someone had a substance use issue or concern, we would usually give them two options, but now we have better options for them. But being able to host that to them was really the greatest pitfall. The benefit is innumerable. I mean, really, the atmosphere is lightened to be noted as recovery friendly. Being able to host that for individuals who are struggling. And as was stated, as far as stigmas, that has been lighted in the atmosphere. So now that the word is kind of trickling out a little bit better, we're able to now reference them and say, hey, there's no stigma here. No one's trying to push you out, and we don't want you to go out on your own. As a matter of fact, it's quite noted that our owner and CEO, John Tyson, struggled with substance use issues. And we quite recently had a substance use issue with his son, something that has been in the news, something that's public. But this is something that I think worked to our benefit because we didn't have a stigma-prone atmosphere company-wide, but now we have processes where we can refer them.
And I want to add to that too, in terms of the communication. So a couple of things happen when you're engaging an employer that's that large. First of all, you have Tyson Wilkesboro, and then you have Tyson Foods, which is,
Sure,
everywhere. So I don't be discouraged as you engage with employers that have these multi-levels of leadership, because it is incredibly valuable to engage all of those levels. So my most recent meetings at Tyson have been with the HR complex manager, with the hiring center manager, with an administrative assistant who is phenomenal and just completed her master's service learning project with us. So she came and she brought Spanish and English materials back to Tyson for their Bright Blue Health Centers. She served our participants at our thrift store. So it's been an excellent partnership, and that leadership training and development is key. Understanding, the ins and outs of the most recent evidence-based practices and just engaging in that communication. I always like to say, in this work, we're all starting a little too late. As with any work with equity and inclusion, we're all starting a little bit too late and at a different point on the at a starting line, I guess. And so we also are working towards a goal that's almost unattainable, to have every employee well connected, every employee in perfect health, every employee abstinent from substances or in a self-defined version of recovery that works, right? So every step, every level of communication, every conversation that we can continue and build upon is valuable. So I just saw in the chat, it says, Ariana, do you find that involving Tyson has made it easier to get other businesses involved? Yes and no. So I think we have to consider the scope of workplaces the same way we consider the scope of people in recovery or people with mental health challenges, disabilities, et cetera. We have very large employers like Tyson who are saying, wow, if they can do it, we can do it. And then we have small businesses that are like, well, we don't have philanthropy dollars. We can't provide those benefits. We can't even pay living wage. How are we supposed to engage? And that is a whole different conversation, because what that looks like is giving permission to have a second job and being flexible with the schedule. And it is, a lot more hands-on, because there's less internal resources for dissemination of information. They don't all have a teleprompter and a John to come and do, excellent communications work. So, definitely having a big name like Tyson has been a wonderful, wonderful asset to our initiative. I would also say that it depends on which business you're talking to, if it's helpful or not. If a county wants to use strategies for workplace and employment related services, how do they explain that to the general public, especially if they think there are higher priorities? How would you suggest a county get started? That's a great question. I think when we look at some of those statistics I was talking about with the National Safety Council, we can see and communicate a little bit better that there is economic development work happening when we have a focus on recovery to work efforts. And I say recovery to work, I fully believe wholeheartedly that recovery to work and recovery friendly workplace initiatives need to be as separated as possible, working together by all means, collaborating by all means. I mean, in terms of resources, because if it's an individual in recovery or a major employer, the individual in recovery's voice will always be lost out. So the people that are doing the recovery to work efforts, meaning educational attainment, career training, soft skills training, they need to have their own resources for individuals. The most important thing I think I can say, and I'll say this quickly, as John mentioned, we're between generations, but not only does that mean that culture is shifting, we had a baby boomer generation, the size of which we will never see again. We just won't. The birth rates are decreasing. Options for non-traditional workforce engagement are increasing. We had the baby boomers, and even before they started to leave, it was an influx of Gen X. So we had this robust workforce where employers really held the hand in terms of what things were going to look like in the workplace, and how that turnover and retraining was going to be mitigated, right? So now we have a time when we need to build capacity within each individual worker if we're going to maintain productivity. In addition to other kinds of innovative solutions like tech and automation, but I think it's really important to advocate that not only are we in a time when mental health is a crisis, when opioid overdoses are an epidemic level, but also that these lives aren't just a unique participant pool to consider, but that in order to get them to be the workforce we need them to be, and in order to prevent our current workforce from switching places, we need to have some more robust supports available to our employees and to our job seekers. And employers want it. They're curious. They, they've heard the information before. Like John said, Tyson was doing this work, right? It's not new. And the more engagement they have with community partners, the more of the burden they can share, right? We don't all have to do everything internally. The more that they can collaborate, the better affected their employees will be.
Yeah, and like you said, even answering the next couple of questions is how to get the county, involved. I think, Wilkes County has done a great job. I think there's just buy-in on every level when it comes to Wilkes Recovery, being in those spaces and having, I think, big employers, your hospitals kind of leaning in on this. Fighting it, I don't think we can, hide our head in the sand here. I mean, this is a major issue. And I think even answering the question, how did all of, Tyson leadership react to all of this becoming, at first it was a stigma. Why are we doing this? Why is the need there? But once we rolled out the facts, the data, the information, and then talking about your cousin and talking about, your aunt, making it more relevant to the space that we're living in and the times that we're living in, there was no way that people could really turn their back on it. They had to embrace it. We encounter it on a daily basis. Some people are just great hide and seek, if you will, playing hide and seek at work. They're functional, but they need help, and they need to be able to say that here is an advocate, here is a road, here is an option for you. It's not mandated, but here is an option. And being able to highlight that in the space of counties that are facing this daily, bringing that data front and center, having a competent partner, experienced partners like Wilkes Recovery is going to get, I think, great buy-in, which has in Wilkes County and other counties as well.
Excellent answer. Let me go back up to see. Let's see. You said something and it sparked my memory, so hopefully it'll come back because I've got some severe mom brain right now. But there's a really good question in here about recovery-friendly workplaces being different in different industries, schools, government, hospitals. And that's what I really love about the fact that we've named our statewide program Recovery-Friendly NC. And this is a program where we're hoping to build out the capacity to offer more technical assistance, to be able to open up our employer trainings and orientations to more than just Wilkes County. Because, these are really robust questions. I mean, schools, we just heard from an expert on recovery-friendly schools, right? So that is something that we need to discuss. We also need to engage the current schools and school board in integrating recovery-friendly practices so that we have that prevention in typical schools or public schools. With hospitals, we're looking at IVCs and we're looking at the capacity for behavioral health in emergency departments. Rowan County, I mentioned before in a smaller group discussion, but Rowan County is working to open a behavioral health urgent care unit. They are popping up across the state. There's some out east, and forgive me if I'm leaving any areas out, but that is where you get that targeted specific treatment and support for individuals so that we're not burdening those who aren't trained or specializing in these issues in our emergency departments. We also know that in order to have some emergency departments that can be more recovery friendly, harm reduction is really important. We, as individuals, we all have internal systems that they're all good. They're all meant to protect us. One in particular called the behavioral immune system, is something that happens when we create a bias to protect ourselves. So one perfect example in an emergency room setting is people in recovery did not get the COVID vaccine. I don't want that patient. So the important thing there is not that we fix our internal systems or change the fact that we create biases to protect ourselves and our loved ones, but to honor that, to see it, to accept it, and to change your behavior based on your understanding of that process. I love the workplace model because it is in New Hampshire, it's working towards becoming evidence-based. We do have data that shows its effectiveness. As we heard from Tyson, we have, anecdotal evidence that it's being successful. But as we grow this out, it really takes a collective impact. It really takes, I love achieving collective impact through results-based accountability. It combines two of my favorite strategic planning activities. So we're looking at, what do we want the end to look like in a hospital? What do we want recovery friendly to look like in a government office? And then we're working backwards from there to create solutions to get us to that end result, where there's a shared agenda, there's shared engagement, and that everybody at the table has some kind of positive impact from their investment. I do see, again, Tyson was on that steering committee with us. I do see employers in Wilkes County engaging more and more, because this is, the hiring crisis, the Great Resignation. These are big, big events that they're facing that they need solutions to, and these are solutions that are working.
Yeah, if I could jump in and on just a few things. I mean, the bias base that we encountered from it first launching was really, I think, deterred, overshadowed by the information that we gave on not just launching this new title, this new event, but kind of a work culture acceptance. It's not acceptance of, just stay like you are and a pat on the back. This was coaching. This was something that was labeled as a help, to define your space, how you see your health getting better, how you want to approach that. But here are the options. It wasn't launched as, okay, everyone just stay where you are and be how you are. But here is where we're trying to embrace this atmosphere that there are people here who have serious substance use issues. There are people here who have emotional issues, and here is your help. This is your direct path, because we want to give you that help and aid if you so desire. And so in the clinical space, we can't really name names. I see the question that's asked, do we have success stories? Absolutely. There are many individuals that have come back, have had engagement, are presently in recovery. And the greatest success story is being able to say, I have an issue, and here is a solution. Here is an option. Here are options. That is our greatest success story. And I don't want to overshadow that by the individual data. We have changed our metric. When people come through our hiring center, we have a data sheet where we now openly ask, do you have substance use concerns that you want help with? And we direct you in that. And I'm the informed individual that they come in contact with so that we can direct them. So those are the success stories, embracing the atmosphere, what is, and then saying, here's the directions if you so desire.
Yeah, and I'll speak to some of the success stories too, again, without naming names, but some kind of specific stories. And I love what you just said, John. We've had we've had a crisis call, that we went out and one of our peer support specialists just sat down with that individual, got them some resources, got them, back in a clear headspace. And I believe she went right back to work. Mm-hmm. We've also had, even before designating, Tyson has allowed their employees to come over here at the end of the day and meet with their peer support specialists and kind of engage in that recovery support and what that looks like for them individually. And I will say that recovery is infectious. Once people start talking about it and they start talking about the things that they're doing to build up their own personal journey of recovery. And I love that Tyson is encouraging individualized journeys. So you don't have to go to treatment or be fired. You can engage with Wilkes Recovery Revolution, and we're building out partnerships with another one of our designated workplaces, which is a treatment center for medication-assisted treatment. So kind of recognizing and owning the fact that people are productive and healthy when you can see the efforts of their productivity, right? And that's the measure, not the pathway that they took to become productive and healthy. Okay, let's see. Okay, so there are definitely other areas in North Carolina that are seeing progress. I think Asheville has always been, a really good example for a recovery ecosystem. In particular, there's a program through Biltmore Estates and Biltmore Farms called Hospitality Heals, they pay a portion of your transitional housing fees if you're in recovery and you're an employee of theirs. So, just small examples of like that aren't as organized or as vocalized, but that are really making an impact in individual wellness and giving them stability, giving an individual stability in that transitional period, because at least even though their environment is going to change, their social group is going to change, their employment is going to remain the same. Let's see. How specifically do you see settlement funds and recovery workplaces benefiting each other? I see it already happening. I see that the conversations that are happening in communities about how to most effectively spend this money, the engagement from non-traditional stakeholders, again, that consideration of a collective impact. We're getting limited monies. So where are we going to spend it and how are we going to see that impact? Employers have a seat at that table. Employers also sometimes have philanthropy funds and benevolence funds where they can spend a little bit of their money investing in this. For example, a van share or housing, employee housing. The next one's for you, John. It says, how do you personally feel about the program at Tyson? And also, if you could give your perspective as a spiritual leader at Tyson in your community.
Personally, I mean, as far as Tyson becoming the employer of choice, I think it's really the mantra is being set out. I think we have great leadership from corporate that has really leaned in and kind of set the mark high for us. As I said before, I don't really get into jargon and billboards. I like to hold feet to the fire. Pastorally, 18 years being in a congregation was great. It just didn't have the footprint that was effective for me at that time, and being able to engage people on a daily basis, seeing people from not having a car to getting on their credit straight, and then through Tyson having free credit counseling, and seeing them being able to get independently, and then trying to kind of grow their space is just phenomenal. I mean, it's a great space to hold a great Fortune 100 company feet to the fire. They welcome it. We put out slogans, but being a chaplain, that's what I'm there for, to make sure that if someone were walked out and had a substance issue, that my space is to walk back to HR and grab them and say, no, we've got to figure out if there's another way here. That's just how I feel. I feel, like I said, blessed in a short statement. I feel blessed to be able to do this on a daily basis. From a faith perspective, I think it's the reach of influence. This is the marketplace, and being able to be there in that space to affect change on a individual base, not forced, but an option. Being able to say, here's an option. Here is me educating you on what a benefit looks like, because not everyone comes from the same background. And I think we've forgotten that, that opportunity looks different from different people because they don't have pure advocates for opportunities. So I hope that answers your question.
Great answer. The next question I love, and I'm glad to have a chance to address it. It says, how does workplace training or retraining for people in recovery fit with the workplace friendly model? So training is vital, and it's multifaceted as with any workplace work, right? Because we have leadership, we have kind of mid-level supervisors, we have employees and staff, then we have their families. So and job seekers. So training needs to happen at all levels. And when we're talking about leadership training, again, we're trying to gear that thought process back towards evidence-based practices. And abstinence is a great example of that. We're not trying to get everybody off of drugs. We're trying to get everybody healthy and well, however that looks for them. It's important that we know kind of the medical background for that. Even if it's not our scope of practice, we have to understand the differences between addiction and dependency, and where medication assisted treatment can kind of fit into that and into their workplace productivity. When it comes to job seekers, a lot we hear this focus on soft skills training, and yes, we do need more soft skills training. It's kind of the thing that the American education system has pushed into the family and home life space that a lot of people don't have. So we do need more soft skills training, professionalism, how to communicate your needs, how to communicate to somebody else who may need you. And so we are having those types of conversations in our training. But with, job seekers, what I love about what Tyson does in particular, and a lot of our other designated workplaces do, is that they incorporate that into their onboarding process. Yes, you need employees that have soft skills. And so we are doing the work of training them. We are investing in that process so that our job seekers have employees. So let's see. Job seekers have the skills that the employer needs. The questions are coming in. I love this. So John, is all the information you're sharing in the toolbox, or is it separate? And can you please share it? Are you talking about the recovery friendly workplace toolkit that we created? I will. Yes. Okay. So all of the information, that John is sharing, I'm assuming, the toolkit is a good resource for information. In terms of his data, we have meetings scheduled to go through with that administrative assistant who was our intern to kind of look at what we're doing that's already recovery friendly, what we've done together, what Tyson, initiated, and to get some of that data included. I think that type of storytelling and that type of anecdotal evidence of success is really going to drive engagement with other employers. And then another question for John. It says, when companies don't have a chaplain, can an HR person serve in the same role? And have there been recovery friendly NC presentations to the State Human Resources Management Association? I didn't mean to combine those two. We haven't directly presented to State Human Resources Management, but we do really value their input, especially when it comes to building out tools like a recovery EAP, which we're working with Smart Recovery on, and then we would engage them at that point. I think it's come to my attention that perhaps there are some policies in the state Office of Human Resources that maybe could be reviewed with a non-critical eye, but just to see if it's recovery friendly for state employees. And now on to John, the chaplain and HR role.
Yeah, so I work in the HR space. That's where we recently kind of segued from, but that's kind of working in tandem as far as chaplains. But HR really does have that same highlighted function. I guess it's the clinical hours and expertise as far as chaplains are trained in that would kind of separate, but it would kind of still fall in line with a people solutions orientation. So HR can, and all they have to do is engage, especially if they have that kind of leader buy-in. So if they kind of run as far as head of HR, and they kind of get buy-in from whomever they report to, I don't see why there would be an issue. And that's kind of how ours functions. We have a complex HR who kind of is the yes or no, and then we have for our corporate HR, and they say yes or no on certain projects that we kind of involve in. But on the HR does usually deal with it because I'm one and it's 3,000 people. So I don't get to engage on all of those cases, and they have to. That's the good part about having their buy-in, because they can just directly refer as well. I hope that answers the question.
Yeah, and I just want to interrupt just a second. You both are doing so great, but I want to let everybody know out there, as you've listened to Ariana and John, you're going to hear different elements. So like you said, if you just looked at the employee handbook, that would be working in recovery friendly workplace, right? So it can be that, or it can be creating an entire program. It depends on where you're going. And I will also say this can sound a little daunting because some of this means even cold calling on some level. But this is where I'm going to throw in PRISM again, because PRISM would love to help you in your county go out to some of your local organizations, hospitals, industry, whatever it is. And it can be a mom and pop outfit. It can be huge. And we will help you go in there because that's part of our expertise. So don't concern yourself with some of the the hows, just listen, and then we'll figure it out together. Right? Is that true?
Yeah, and that's, that is my goal in offering assistance at this point, is to demystify the world of employer engagement. I think, especially in recovery services, historically, it's been take a chance on this person and hopefully you'll have a great employee. And that's the ask, and that's the go-between. This is so much more. It's not saying, employers, you don't have the information, you don't know what you're doing, let us train you. It's let us partner, let us look critically together in a judgment-free way at what policies are causing harm that we can work together to fix, and what is going well. And what John's answer to the question about chaplain, HR, and the intersection there is spot on. It is the degree of training. So, if nobody in your workplace has taken like a mental health first aid class or a crisis intervention, certification class, or there's nobody in recovery who's offering a helping hand, that's something to look at. And that can be a small tweak. You can also make recovery friendly changes by increasing the number of spaces that are comfortable in your workplace, like a break room being somewhere where people are encouraged to spend 15-minute breaks, so that we can avoid these like hour-long breakdowns of time with crises. But these are great questions.
I mean, even also the BRG space, the business resource groups, I've had encounters with individuals that are starting to have that kind of support group, and kind of having that business resource groups makes it more popular, makes it not isolated, makes it more accepting. And then having some success stories come from that as far as support is concerned, I think would also channel up higher as far as HR space is concerned.
So, John, I got to ask you, how come you started to laugh when I said that?
No. Like I said, I think
it's a good laugh. I'm just curious.
An excellent laugh. Like you, that was a great plug. I mean, an excellent plug. You executed it very well. But absolutely, I think we're just here to kind of say, hey, it can be done. It's not as hard as it sounds. It is not. It's just kind of doing that snowball effect and having partners like Prism and Wilkes Recovery in your wheelhouse, and you'll have no problems whatsoever. Well, excuse me, a few obstacles, but not too big.
but then we'll talk about it, right? Then we have experts who are dealing with this. I mean, you have Novant Health too, right? So you're covering different areas, medical and so forth, that they've made lessons. I was going to say mistakes. They've made their lessons, and then we can learn from the lessons they're making. Right. So there's no place we can't go, nothing we can't do.
Yeah.
But
just
we can
opportunities.
Do it just opportunities. So I want to ask everybody in here, does anybody have any questions in our room right now? Do you have anything else that you want to add?
Yeah, I definitely, I encourage engagement. I encourage you to start talking about this with your communities, because that is really, as I mentioned, how it started in Wilkes. It's about, combating that stigma with information. Then if I were to ever publish a training, it would be interrupting stigma, because there is a way to do it politely. There is a way to hear somebody self-stigmatize and to not criticize them or tell them that they're wrong, but to encourage them to use better language when they're talking about themselves, through showing that. And so, begin these conversations, begin looking at what resources you have. Those are the first steps. Resource mapping and bringing people to the table to have these conversations. And you'll be surprised at who comes to the table and what questions they have, talking about the spiritual space. And we have congregations come and, and offer their services to any of the programs at Wilkes Recovery Revolution. A lot of times we hear, oh, we're not prepared to do that. We just aren't resourced well to handle issues of addiction. And then I think back to my executive director coming back to Wilkes with her vehicle and the money in her pocket, and making steps towards becoming a peer support specialist while providing support for people in the community. You do have the resources, you do have the stakeholders around you. It's just a matter of engaging them effectively.
And sometimes we look too big. I mean, we don't have to look big. This is a big problem, but sometimes we're going to just address it step by step, baby step by baby step, and just, do that. And then we just build on those steps. So, I mean, we don't have to, do this whole huge thing. We could just step by step, and we can see, I mean, this is a huge thing for any county.
Mhm.
For urban development, developing your workforce, developing your finances, I mean, getting industry there. I mean, it's a big selling point.
It
So
is.
right,
It is.
and we can start anywhere.
Yeah, just the one plea I would have, and thank you all again for this opportunity. You know,
We're going to call upon you again, John, don't worry.
yeah, no problems. Like I said, just the plea of individuals that I see that sit across from me, tearful eyes, wrecked lives, just having this advocacy and just trying is worth it. That's the success in this. It's just trying. It's not about it being beautiful and it's got all the bells and whistles. Just try, because that one person is worth it. That one person, those 10 people who are going to interface with professionals that care, that aren't just trying to get more grant money, but really care, like Wilkes Recovery. That's all it's worth. And you will save a life, absolutely, down the road, and break stigmas as well.
Beautiful.
So I know that anybody have any questions? And I know that Devin might be here. I don't know if she wants to make a plug, but you're welcome to, Devin, and anybody else who maybe, if any of you out there have been doing any of this or thinking about it or making any steps forward, we'd love to hear your comment now. And the next thing we're going to do is we're going to just have our next thing, which is a breakout where we're just going to talk together. So we're headed into there now. But before we do that, does anybody else have any final questions or anything of Ariana or John or me? Anybody? Is there anything in there? Because I can't see the chat. No? Okay. So I thank you both so much, because this is a very favorite subject of mine, because it just means so much on all the levels. If we can get people jobs, it's amazing, right? So, okay, so we're going to come right back, and hopefully the two of you can stay for a bit and ask some further questions in the breakout, and we'll be right back. Thank you.